Hello and welcome back to Simple Social Sciences. Today we are going on to our biological treatment for schizophrenia, carrying on the schizophrenia series. By the end of this session, you should be able to do the following. Number 1, outline how typical antipsychotics are used to treat schizophrenia. Number 2, outline how atypical antipsychotics are used to treat schizophrenia. And number 3, assess the advantages and disadvantages of using antipsychotics to treat schizophrenia. So the biological approach to treating schizophrenia uses drug therapies. There are 2 different types of antipsychotics used to treat schizophrenia. The first is typical antipsychotics, which were the early and traditional antipsychotic treatment. And then we have atypical antipsychotics, which are more recent versions of antipsychotic medication. Before we go any further, let's quickly recap synaptic transmission. So in this diagram, you can see the presynaptic neuron and the postsynaptic neuron. This is important to note because signals within neurons are transmitted electrically, but signals between neurons are transmitted chemically, and this is through neurotransmitters. So the presynaptic neuron transmits signals through these neurotransmitters to the postsynaptic neuron. So the very first step in synaptic transmission is the electrical impulse within the presynaptic neuron, triggering the release of a neurotransmitter from the synaptic vesicle. One example of a neurotransmitter is dopamine. The dopamine will diffuse across the synapse. The receptor sites at the postsynaptic neuron will then receive the information regarding dopamine. Excess neurotransmitters go through a process known as reuptake, so it's reabsorbed by the presynaptic neuron. The electrical impulse will then occur at the postsynaptic neuron, and this process will continue. So now let's apply this to typical antipsychotic drugs. Typical antipsychotic drugs work by acting as antagonists in the dopamine system, and this will reduce the action of dopamine. This treatment is strongly associated with the dopamine hypothesis. So dopamine antagonists work by blocking dopamine receptors, reducing the action of dopamine. Initially, by blocking the dopamine receptors, this will build up levels. However, the production is then reduced. This will normalize neurotransmission in key areas of the brain, which in turn reduces symptoms such as hallucinations. Typical antipsychotics can be taken by tablets, syrup, or by injection. If taken orally, daily dosage can go up to 1,000 milligrams, although for most people this will not be the case. It will be much lower. Syrup is absorbed faster, and it's usually given in hospitals to calm patients down. Atypical antipsychotics work in a similar way as typical psychotics by binding to dopamine receptors. However, these drugs also act on serotonin and glutamate receptors. This drug is far more effective than typical antipsychotics. This is because it reduces depression and anxiety in patients, as well as improving cognitive functioning. Improving mood is an important factor, as up to 50% of those suffering from schizophrenia also suffer extreme depression. This could be what makes this drug more effective. However, early atypical antipsychotic drugs had severe side effects despite being more effective. More recently, atypical antipsychotic drugs overcome the limitations of typical antipsychotic drugs and the severe side effects of atypical antipsychotic drugs, and act as the most effective form of treatment. So when evaluating the biological treatment, we must consider the strengths and limitations of using drug therapy to treat schizophrenia. We're questioning, is this an effective treatment or is it not an effective treatment? So rather than looking at the validity of a theory or the reliability, generalizability, and so on, we're actually focusing on, is it effective or is it not? Well, first, we can look at the strength of using a biological approach. One of these strengths is shown in the supporting evidence for drug therapies. So evidence shows that antipsychotics are moderately effective in drug trials by Thorney 2003. However, a problem is doubts about the true effectiveness of antipsychotics. Although there is good evidence that antipsychotics are effective, researchers such as Healy have suggested that some successful trials have had their data published multiple times, which exaggerates the evidence of positive effects. Furthermore, just because antipsychotics have powerful calming effects, this doesn't mean that they actually help treat schizophrenia. To make it worse, most published studies assess short-term benefits rather than long-term benefits, which all point to the same question: can we trust the evidence that supports the effectiveness of drugs? This suggests that drug therapies may not be as effective as previously thought. Another limitation of antipsychotic drugs are the side effects. These range from mild to serious and even fatal. Typical antipsychotics are associated with a range of side effects such as dizziness, agitation, sleepiness, stiff jaw, weight gain, and itchy skin. Long-term use can result in further disorders, including dopamine supersensitivity, which results in involuntary facial movements such as blinking and lip smacking. Such side effects are a significant weakness of using antipsychotic drugs to treating schizophrenia. This is because people may not want to take their medication if they're experiencing more of the mild symptoms, and those requiring high dosage for a long period of time are more likely to experience severe side effects. This would not be a useful approach to treating schizophrenia. A final limitation of using antipsychotic drugs to treat schizophrenia relates to the way it's used in hospital situations. So in hospitals, antipsychotics are used to calm people down and make them easier for staff to work with, rather than benefiting the people themselves. Although short-term use has helped to calm agitated people down, this practice has been seen by many as a form of human rights abuse. This is because it's effectively controlling patients' behavior. Therefore, drugs can be said to be dehumanizing as they take away individual responsibility and control when they may not have consented to treatment. They might be in a position, such as a psychotic state, where they are unable to give consent, and especially if they are sectioned, treatment can be enforced without consent. The heavy ethical implications related to this treatment would suggest that drug therapy may not be the most effective method of dealing with schizophrenia. One of the ways you could be assessed on your knowledge on this topic could be a question like this: outline and evaluate drug therapy as a treatment for schizophrenia. Now, this is a standard 16-mark essay assessing just AO1 and AO3 without a scenario. However, it's a good practice essay to write for revising this topic. You can find a step-by-step instruction on how to answer this essay question coming very soon to Patreon, as well as Anchor subscriptions. For just $3.99 a month, you can have instant access to this. As well as a step-by-step tutorial, you also get a model essay plan which you can download and a model essay for each of the exam questions. So links for the Patreon and Anchor are in the description. Don't forget to follow our Instagram and TikTok at MissJ_MissD. So now you should be able to outline how typical and atypical antipsychotics are used to treat schizophrenia, as well as assessing the advantages and disadvantages of using antipsychotics to treat schizophrenia.